Hey everyone, this is Arun Kumar. I'm a certified professional coder. In this video, we're going to see where to use modifier 24, 25, and 57. What is a modifier? A modifier is a two-digit numeric or alphanumeric code. The modifier provides additional information about the medical procedure without changing the meaning of the procedure. A modifier may also provide details not included in the code descriptors, such as anatomical location of the procedure. Before moving to modifier 24, 25, and 57, we should know the global surgical package concept. When we are billing a service, there is a global period for each service. For some procedure, you will have 0-day 0-day period, and some for 10-day and some for 90 days. Here, 49000 CPT code have a 90-day global period, and when we are billing this to the insurance, they do not pay like separately like preoperative, intraoperative, postoperative. They pay 100% combinedly, like for preoperative 9%, intraoperative 81%, for postoperative 10%. So they pay 100% completely for the global procedure. Okay. E&M services not included in the global package. So as I said earlier, services which are included in the global surgical package, right? So what are the services which is not included in the global surgical packages? There are a lot of services which are not included in the global surgical packages. In this video, we're gonna see these three concepts like E&M visits unrelated to the diagnosis for which a surgical procedure is performed is not included in the surgical package. Significant separately identifiable E&M service by the same physician or other qualified healthcare physician on the same day of procedure or other service is not included in the surgical package. And initial consultation or evaluation of the problem by the surgeon to determine the need of major surgery, that is decision for surgery, which is not included in the global procedure. Okay, modifier 24. The description for modifier 24 is unrelated E&M service by the same physician or other qualified healthcare professional during the postoperative period. So for example, a patient is a 90-day global period, and he is in a post-operative period, right? The patient comes in for a E&M visit, which is unrelated to the procedure, global procedure during the post-operative period by the same physician. We have to add modifier 24. So append modifier 24 to an E&M service when the provider renders an E&M during the patient's global period, but the E&M is not related to the patient's surgery. When you report modifier 24, the E&M service must meet these criteria. The E&M services occurs during the postoperative period of another procedure. So it has to be in a postoperative period. The current E&M service is unrelated to the previous procedure. So the current E&M service is unrelated to the service procedure which was done previously. The same physician, that means tax ID, are the same group and specialty who performed the previous procedure provides the E&M service. The patient diagnosis documented must meet medical necessity for the visit. The document should support it is medically necessary. The diagnosis submitted is medically necessary. Example, sometimes a physician examines a patient within the 90-day global period of a major procedure, but for a different problem. For instance, the physician operated on the patient's anus a month later. She sees the patient for hypertension problem. That might be when you call on modified 24, because a month before patient admitted and procedure done on the anus. Today the reason for an E&M visit is hypertension. Both are two distinct diagnosis, right? So that is called unrelated evaluation and management service by the same physician during the postoperative period. So for this case, we have to add 24 modifier to the E&M service to mention that this is an unrelated service. When the patient has an E&M service with the provider for post-operative visit for the same condition, you have to assign the no charge code, that's post-op CPT code 99024. If the patient is coming, today reason for a visit is for the follow up on a patient's procedure done on the ANAS, that is a related procedure. For this case, we cannot add modifier 24. This case, we have to add modifier 99024, mentioning that this is a post-op visit. This visit is actually included with the major procedure. Okay, moving on to modifier 25. The description for modifier 25 is significant, separately identifiable E&M service by the same physician or other qualified healthcare professional on the same day of the procedure or other service. For example, if an E&M service is done during the same day where a procedure was done, we have to check whether this E&M is significant, separately identifiable E&M from the procedure or not. If so, we have to add 25 modifier. Append 25 modifier to an E&M service when the provider renders an E&M to the patient on the same day as another service or procedure. The medical documentation has to justify performing the separate E&M service. The patient condition may warrant the same provider perform a separate E&M service and another service or procedure on the same day. I have an example from Modifier 24 for an established patient is seen for a finger laceration which is closed with a simple repair. Here they have mentioned like the provider, the patient is established to the provider and is having a laceration in the finger which is closed with a simple repair by the provider. The patient also asked the physician to evaluate his sinus problem, which is addressed with an expanded problem focus history and examine low medical decision making. So the patient presented to the provider with two problems. A surgical procedure was performed and a separate E&M service was performed to address the second problem. The visit notes clearly document the assessment and treatment of two problems separately. So we have to add 25 modifier to the E&M service. In some cases, you may not get two different diagnoses for the E&M and the procedure on the same date of service. For instance, patient comes for a condition. For that condition, providers do an E&M visit that is separately identifiable. And also for the same condition, providers do the procedure. In that case, we have to add 25 modifier for the E&M, and we have to give same diagnosis for the both the E&M service as well as the procedure. Decision for surgery. The modifier 57 is for decision for surgery. Append modifier 57 to an E&M service if the provider decides to perform surgery the same day of the E&M service or the day before. For some services, the providers do the decision for surgery on the same day. For some procedures, they do a day before based on the patient's conditions. To append modifier 57 properly, you must remember these key points. The E&M service occurs the day of or the day before a major surgical procedure, a procedure with a 90-day global period. The surgical procedure should be a 90-day global procedure. The E&M service must prompt the surgical procedure that follows. The E&M service must be related to the procedure that follows. So in order to give 57 modifier, the E&M service as well as the global procedure, both has to have a same, diagnosis. The same provider or tax ID provides the E&M service and the surgical procedure. So we have to build same tax ID for the E&M as well as the procedure on the same on the service. If E&M services are on the same day as a minor surgery with a 10-day global period or no global period, upon modified 20 for 20 E&M service, not 57. If the global period for the surgery is 10-day or the 0-day, we are not allowed to add 57 modifier to an E&M service. We have to check whether this document supports to add 25 modifier, and you can also append modifier 57 to ophthalmological services 9202 to 92014. Here is an example. A patient presents to the emergency department with abdominal pain and fever. The consulting surgeon documents a level 3 outpatient consult and decides at that visit to perform an emergency appendectomy. In this scenario, this tells like the morning patient wakes up with an abdominal pain. The provider does an E&M service and makes a decision that he needs an appendectomy surgery as soon as possible. So in this case, we can bill E&M service 992243 with 57 modifier decision for surgery along with the surgical procedure 44950. That's all. If you have any doubts, comment me below. I'll help you out.